Question number 1.
Nurse Mimi is providing education to group of students about diverticulosis. She doesn't require any further education if defines the disease as A. Small, bulging pouches develop in your digestive tract. B. Inflammatory bowel disease causes your digestive tract to become swollen and irritated. C. Is a condition where your immune system attacks your own tissues when you eat gluten. D. Missing nerve cells called ganglion in the muscles of the baby's colon. The correct answer is letter A. Diverticulosis are small, bulging pouches develop in your digestive tract. When one or more of these pouches become inflamed or infected, the condition is called diverticulitis. The exact reason why diverticula develop is not known, but they are associated with not eating enough fiber and inadequate bowel movement. Inflammatory bowel disease causes your digestive tract to become swollen and irritated is known as Crohn's disease. A condition where your immune system attacks your own tissues when you eat gluten is known as celiac disease. Missing nerve cells called ganglion in the muscles of the baby's colon is known as Hirschsprung's disease.
Question number 2.
Nurse Mimi is correct when providing education to group of students that patients with diverticulosis are most likely to have diverticula located in the A. Transverse colon, B. Rectum, C. Sigmoid colon, D. Ascending colon. The correct answer is letter C. Sigmoid colon. There are 6 parts of the colon. It starts with the cecum, which attaches to the small intestine to the large intestine. Other parts of the colon includes the ascending colon, the transverse colon, the descending colon, the sigmoid colon, and the rectum. Diverticulosis can occur throughout the GI tract, however, it tends to be most common in the sigmoid colon because it is mostly the part where the highest pressure happens as the stool travels to the anus.
Question number 3.
Patient Louise asks what type of testing is performed to assess for diverticulosis. As the nurse, you know that which test below is used to assess for diverticulosis? A. Fleet's enema. B. Colonoscopy. C. Bronchoscopy. D. MRCP or magnetic resonance cholangiopancreatography. The correct answer is letter B. Colonoscopy. It is a procedure in which a doctor uses a scope that is inserted into the rectum down to your colon. This would allow the doctor to visualize irritated and swollen tissue including formation of sacs, which is called diverticula. Fleet enemas are injections of fluids used to cleanse or stimulate the emptying of your bowel. However, it will not help in diagnosing diseases such as diverticulosis. Bronchoscopy is a procedure that lets doctors look at your lungs and air passages. It's usually performed by a doctor who specializes in lung disorders and not with gastrointestinal diseases. MRCP or magnetic resonance cholangiopancreatography is a procedure that uses a powerful magnetic field, radio waves, and a computer to evaluate the liver, gallbladder, bile ducts, pancreas, and pancreatic duct for disease.
Question number 4.
Louise is experiencing an acute episode of diverticulitis. He is having abdominal pain, temperature 102.6 degrees Fahrenheit, and elevated WBCs. As the nurse, you know it is important to A. Encourage intake of high-fiber foods. B. Monitor the patient for peritonitis. C. Apply a heating pad to the patient's abdomen to help alleviate pain. D. Encourage intake of full liquids. The correct answer is letter B. The patient experiencing an episode of acute diverticulitis is at risk for abscess due to the presenting infection if the affected pouches ruptures. Therefore, the nurse should monitor the patient for signs and symptoms of peritonitis, which includes increased heart rate, respiratory rate, abdominal tenderness, bloating, and high fever. Encouraging high fiber intake would not help the urgent scenario. Applying heat pads to the patient's abdomen will just worsen the situation, as heat would cause vasodilation leading to rupture of bowels. Fluid intake will be not necessary for this case.
Question number 5.
In relation to the previous scenario, Louis' signs and symptoms are starting to subside. As his assigned nurse, which of the following food items would be best for the patient to consume? A. Oatmeal and bran. B. Orange juice and eggs. C. Chicken broth and jello. D. Salad with chicken. The correct answer is letter C. During the recovery phase of diverticulitis, the patient should start with clear liquids like broth, jello or ice, followed by low-fiber diet until healed. After the patient has fully recovered, they should consume a high-fiber diet and stay hydrated.
Question number 6.
Louise, who was hospitalized with diverticulitis, is about to be discharged. Which statement by the patient requires re-education? A. It is important I consume a diet high in fiber and keep hydrated to keep my stool soft. B. The physician prescribed me to take psyllium every day, which will help prevent constipation. C. I will be sure to always cook and skin my fruits and vegetables rather than eating them fresh. D. I will notify my physician if I develop abdominal pain and fever. Let's apply the process of elimination. It is important I consume a diet high in fiber and keep hydrated to keep my stool soft is advisable to maintain good bowel movement and will help avoid diverticulosis to reoccur, which makes option A a positive statement. Psyllium is a form of fiber made from the husks of the Plantago ovata plant seeds. It can help relieve both constipation, diarrhea and other intestinal problems. Therefore, consuming this would be beneficial for patients with bowel disorders, making option B a positive statement. The patient should consume fresh fruits and vegetables because they contain the most fiber. However, fruits and vegetables that have been skinned or cooked have low amounts of fiber in them. This makes option C a negative statement and requires further education of the patient. Notifying the physician when developing abdominal pain is an indication that the patient have understood the discharge teaching, as it may indicate other complications such as peritonitis. This makes option D a positive statement by the patient. Therefore, the correct answer is letter C.
Question number 7.
True or false? Most patients with chronic diverticulitis require surgery at some point, such as a bowel resection. If the healthy bowel cannot be reconnected right away, a permanent colostomy will be created until it can be reconnected. A. True. B. False. The correct answer is letter B. False. Most patients with chronic diverticulitis require surgery at some point, such as a bowel resection. If the healthy bowel cannot be reconnected right away, a temporary colostomy will be created until it can be reconnected.
Question number 8.
Louise was admitted to the medical unit with a diagnosis of acute diverticulitis. Which healthcare provider's order should the nurse question? A. Insert a nasogastric tube. B. Start an IV with D5W at 125 milliliters per hour. C. Put client on a clear liquid diet. D. Place client on bed rest with bathroom privileges. The correct answer is letter C. Putting the client on a clear liquid diet. The nurse should question a clear liquid diet because the bowel must be put on total rest, which means NPO.
Question number 9.
Louise was on 2 hours post-colonoscopy. Which assessment data warrants immediate action by the nurse? A. The client has a soft, non-tender abdomen. B. The client has a loose, watery stool. C. The client has hyperactive bowel sounds. D. The client's pulse is 104 and BP is 98/60. Let's apply the process of elimination. Client has soft, non-tender abdomen is a good sign and has no indication of peritonitis. Therefore, letter A is a positive statement and doesn't require any further action by the nurse. The client has loose, watery stool is considered as normal for post-colonoscopy patients. It's because their bowels are being cleaned up so that visualization of the intestine would be clearer. Therefore, letter B is a positive statement and doesn't require further action by the nurse. Client has hyperactive bowel sound is a good indication that peristalsis have returned. Therefore, letter C is a positive statement and this doesn't require any further action by the nurse. Client's pulse is higher than normal indicates that it is trying to compensate a low blood volume supply in the body. Low blood pressure is also correlated to low blood volume, which would indicate that a perforation could have happened in the bowel and internal bleeding might have occurred. This would warrant the nurse to take immediate action. Therefore, the correct answer is letter D.
Question number 10.
Nurse Mimi is preparing to administer the initial dose of an aminoglycoside antibiotic to Louise, who was diagnosed with acute diverticulitis. Which intervention should the nurse implement? A. Obtain a serum trough level. B. Ask about drug allergies. C. Monitor the peak level. D. Assess the vital signs. All of the choices below are correct. However, the most critical step to gather before giving an antibiotic to patients would be to ask about drug allergies. Allergic reactions to drugs can be fatal and can even cause death in some cases. Therefore, the correct answer is letter B. So what is trough level and peak level in medication administration? Let's discuss dosing intervals. A peak drug level is measured at a specified time following the last dose. It is the highest concentration of a drug in the patient's bloodstream. While a trough level is measured at a specified interval before the next dose, it is the lowest concentration in the patient's bloodstream.
Question number 11.
Nurse Mimi is preparing to administer 250 milliliters of intravenous antibiotic to the client. The medication must infuse in 1 hour. She administers the medication via gravity with IV tubing at 10 drops per minute. At what rate should the nurse infuse the medication? A. 40 drops per minute. B. 35 drops per minute. C. 25 drops per minute. D. 30 drops per minute. To easily recall the dosage calculation, just remember the phrase, TV will make you deaf over time, which is interpreted as TV for total volume, make, for multiply, def, for drop factor, over or divided by time prescribed by physician. In our scenario, the total volume is 250 milliliters, multiplied by our drop factor, which was 10 drops per minute. Divided by 1 hour converted to minutes, which is 60. The result would be 41.66 drops per minute. Therefore, the correct answer is letter A.
Question number 12.
Louise, who was diagnosed with acute diverticulitis, has a nasogastric tube draining green liquid bile. Which intervention should the nurse implement? A. Assess the client's bowel sounds. B. Document the findings as normal. C. Determine the client's last bowel movement. D. Insert the nasogastric tube at least 2 more inches. The correct answer is letter B. Document the finding as normal. Green bile contains hydrochloric acid and should be draining from the nasogastric tube. Therefore, the nurse should take no action and document the findings as this is considered as normal.
Question number 13.
The nursing student is working in an outpatient clinic. Which client is most likely to have a diagnosis of diverticulosis? A. A 60-year-old male with a sedentary lifestyle. B. A 72-year-old female with multiple childbirths. C. A 63-year-old female with hemorrhoids. D. A 40-year-old male with a family history of diverticulosis. The correct answer is letter C. Hemorrhoids would indicate that the client has chronic constipation, which is a strong risk factor for diverticulosis. Constipation increases the intraluminal pressure in the sigmoid colon, leading to weakness in the intestinal lining, which causes outpouchings or diverticula. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.